Thank you very much. Okay, so my name is Tim Newton. I'm a psychologist. I work at King's College London. I have some things to declare, declaration of interests. So in addition to my substantive post at King's College London, I also have honorary posts at UCL, at Cork. I work for the NHS in Guy's and St Thomas's Hospital and for the Office of the Chief Dental Officer. I'm being paid to give this talk, and I've also received funding from other people. Good. So what I'm going to try and do for you today is talk to you a little bit about targets for oral health behaviour. I'm going to describe a model of health behaviour change, and I'm going to work through that model in order to describe how you might consider delivering chairside interventions to enhance the oral health behaviour of your patients. So, first of all, always like to emphasise the massive importance of dental disease. Dental disease is a very, very big and important problem. It has a global cost of $442 billion in 2010, which is spread between treatment costs, direct treatment costs, and lost productivity. The cost of lost productivity by dental disease is equivalent to that of suicide, which is quite amazing. It's the third biggest health expenditure in Europe, only after diabetes and cardiovascular disease. Dental caries affects 2.4 billion people worldwide and is the 10th most common disease of childhood and periodontal disease. A further 743 million people affected by that. And of course, the thing is, dental disease is preventable. It's preventable through behaviour change. The problem being that behaviour change is quite difficult. It's not rocket science, it's slightly more complicated than that. So, what do we need people to do? Well, these are the targets for behaviour change, which I'm sure will be familiar to you. We need people to regularly brush their teeth with fluoride-containing toothpaste, to attend the dentist, to refrain from tobacco or stop using tobacco if they currently do so, interdental cleaning or disrupting the biofilm, and reduce the amount of sugar-containing snacks that they have. Okay. So I'm going to try and introduce you to a model of behaviour change, which is called the COM-B model, developed by Susan Mickey and her team, Robert West, as long ago as 2011. But essentially, if we want to change behaviour, we need to think about three things: capability, opportunity, and motivation. So these three things together, the capability, motivation, opportunity, change behaviour. And we can define those in this way. So if we think about capability first, capability has two aspects. It is about having the physical capability and the psychological capability, which is probably most commonly knowledge. So if I want you to brush your teeth, then I need you to have the physical ability to hold a toothbrush, which is not universal, but that may be one aspect. It's a fairly low-level capability skill. The capability for flossing might be more complex in terms of the physical skill required. The psychological skill is knowledge. And of course, we like knowledge. We tend to think about knowledge as being really important. You wouldn't be here listening to me if you didn't think that knowledge was in some way important. So we tend to think that's a really important aspect. Down here, we have motivation. And motivation has two aspects. It has a conscious motivation. So in terms of thinking about planning what we're going to do. So in terms of thinking when you were coming here, you thought about how am I going to get there? What will I wear? Who will I go and see? Where will I stay? All those things. You made planning and decision making to drive your behaviour. But it's also this sort of automatic motivation we had, the habits, the things that we kind of routinely do almost without thinking. They're just kind of driven by some kind of habitual process. And both that planning process and that habit process drive us doing our behaviour. First point I'd like to make to you is that those are capability and motivation are separate. And have you noticed which one knowledge is in? It's in capability. So what I commonly hear is I motivated them by telling them lots of information. Giving information is great, but it's changing capability. It's not motivating. And the third aspect is opportunity. So psychologists often talk about the gap between our intentions and actually doing something. So we can be motivated to do something, but somehow we don't quite manage to do it. So I'm extremely motivated to give up cake, and yet somehow I never manage to get to that behaviour. And that's possibly because I don't create the opportunity to engage in that behaviour. An opportunity has, again, two aspects. The physical opportunity, so access. If I want to go to the dentist, there has to be a dentist, and that's not globally true. But also, I need to have a kind of environment that supports me in doing that. So what I really need is for my wife not to buy cake. And that would create the opportunity. I might be unhappy for a moment, but it would create the opportunity for me to engage in that valued behaviour. Okay, so those are the three things: capability, opportunity, and motivation. And we can think about it in terms of intervening for those. In the green area, we have the capability, opportunity, motivation. Around the red is things we might do one-to-one. So we might train people, we might model, show people what to do. And around the outside, which I won't be talking about today, is the changes we can make at a kind of policy level, which might drive behaviour. So the best example I can give you of that is sugar tax. Great example, how it changes the opportunity for a behaviour by making it more, by incurring a cost to it. Or banning smoking in public places. Had a major effect on smoking rates because it makes it more difficult to smoke. It decreases the opportunities. Good. So I'm going to talk to you about one-to-one chairside behaviour interventions, less about policy. And all that got very complicated. So I tried to make it, Kulas Makapulu, a colleague, and I tried to make it more simple. And we think there is basically a 4-stage process. So the first is about capability to provide guidance about the behaviour. The second is motivation, which is about creating the intention to do the behaviour and to set a goal. The third is to create opportunities through planning for the behaviour. But ultimately, what we really want is for health-related behaviours to shift from being planned to being a habit. So they become habitual. So there's a process by which we want to shift from the planning of a behaviour to it being a habit. So the 4-step process, and I'm going to walk you through those 4 steps, I think. Good. Okay, so capability. Right. So this is about providing guidance, and there are 2 aspects to this I want to talk to you about. One is skill acquisition, and the other is about knowledge. Okay. So, skill acquisition. So, who here has an iPhone? I can see someone's got it in their hand. Great. Okay, and of those who had an iPhone, congratulations. Who read the manual? Come on, someone must have read the manual. There's usually one who goes, yeah, I read it. Oh, did you? Well done. That's very good. Because some people like to read the manual. How did the rest of you learn how to use it? You might have observed somebody doing it. You might have asked your 16-year-old son how you do it. That's how I learnt. But actually what you probably did was you had some kind of demonstration, some observation, somebody watched you doing it, might have given you feedback about what you were doing well. They might have prompted you about things. Because when we think about skills, often we learn skills through those methods. We don't really pick up Picards, flick through the pages, how to do a filling, and then go over and ask this gentleman if I can do a filling on his mouth. He'd want me to have a little bit more training, I hope. Good, thank you. And actually what we're asking patients to do a lot of the time is a physical skill. So lots of things we want people to do, they're physical skills, and yet sometimes we think about written information or even video information. Now, why is that? Well, it's possibly because that's quite easy to do. But the other thing is sometimes we feel that if we've given someone written information, we can tick that box. Okay, so when you think about that, think about how you learnt skills and what you found useful, and think about actually how those demonstrations, the observation and feedback, are really, really good skills. And one of the things I would say about that is, it's best if the skill is learnt in a way that is similar to how it will be practiced. So actually getting the patient to do it on themselves, as opposed to what our undergraduates do, which is they demonstrate flossing on a model, which means they can have the hand inside the patient's head. Makes it really easy. Yeah? But get the patient to do it, give them prompting and feedback. Okay, knowledge. Right, I often say this, so I apologise to those of you who have heard me say it before, but you lot are very strange. You're strangely clever. Did you like that? Yeah, we are actually. But you lot have actually received a lot of education. A lot of education. I mean, if you're a dentist, you spent 5 years at dental school, it wasn't all drinking. You did learn a lot, you got a lot of knowledge. And the hygienists and therapists, you've spent a long time learning those skills, not just formally, but also informally. Same with dental nurses. So you're used to learning knowledge formally and applying it. But that doesn't apply to a lot of our patients. They're not all as well educated as you. And actually knowledge is a really not brilliant way to get people to change their behaviour. But if you want to increase people's knowledge, here's a few tips. 1, tell them the most important thing first. You're most likely to remember the thing you're told first. And that's why I've told you that, because that's the most important. Told you that first. Tell them which is most important. Be specific about what you want people to do, so that then they know whether or not they've done it. If you're general, it's harder. Repeat information or repeat information. Categorize it in an explicit way. So when you used to learn all the mnemonics for the cranial nerves, that's a way, odorous olive, please try and focus a good view. Was that one? Yeah. It was all about categorizing the information so it's more memorable. And written materials should support your interaction, because a person is far more believable than a piece of paper. And actually think about alternative ways of doing that, because if you can learn cross-modally, sort of through vision and sound, you'll have stronger learning. Okay, so capability, what I'm basically telling you is that you should get people to actually practice the skill. Don't tell them about it, get them to do it and give them feedback. That's what I would do. That's what we do. So once we've taught a person the skill, we need to motivate them. Okay, so motivation, I'm going to talk to you about 3 things: goal setting, creating an intention, and self-efficacy. So goal setting, everyone familiar with SMART goals? Okay, SMART goals: specific, measurable, achievable, realistic, relevant to the individual, and timed. And there's a little test, smart or not. Improve your oral hygiene. Who thinks it's smart? Good, you've all passed. Not at all smart. So brush your teeth more? Well, it's specific. It's about brushing. Is it measurable? No. We don't know if it's achievable. could be relevant. We don't know if it's timed. Floss daily, not a sister of test daily. Floss daily is specific. It's measurable because it's daily. Should be achievable. Could be achievable. Could be relevant. Should be relevant. So look at this one. Of course, that's smart. And of course, the thing about SMART goals is they tend to be long. But then you can see whether or not you've done that. Decrease the amount of sugar you eat every day. It's sort of getting there, but it's not really measurable. Actually, that is one of the challenges of sugar, as an aside, the challenges of sugar reduction is actually people don't really have a sense of how much sugar they have. It's quite tricky, and there are apps to support that. Okay, so SMART goals. So having set a goal, what we want you to do is to create an intention to achieve that goal. We want you to be motivated to achieve that goal. We have looked at this in various different ways, usually through systematic reviews, so 700 and odd papers. Have a look at all those papers, see what thoughts predict people changing their behaviour. And if you do that, you come up with three things. The first is emphasis on the benefits of changing the behaviour. Now, the interesting thing there is it's the benefits. It is not the harms. As a psychologist, or the psychologist amongst us, that's a fairly familiar idea because negatively framed messages tend to freeze behaviour. They tend to stop people doing things, but positively framed tend to be very empowering. They tend to drive behaviour. So what we want you to do is think about, for your patient, what are the benefits? Okay. What are the benefits of changing behaviour? I was talking to some periodontists the other day, and I said, what are the benefits of periodontal disease? And one of them said, there aren't any. I said, well, what do you mean there aren't any benefits of helping to rid yourself of periodontal disease? And he said, well, you can only say that you won't lose teeth. And I said, but does that mean that you get to maintain your beautiful natural smile? And he went, But that's that kind of trying to get that framing, that kind of slightly different way of thinking, actually emphasize what you want. The way that we do it is we tend to ask people, what are the problems, what are the things that you currently would like to change about your smile or what your smile gives you. And in my work, I tend to work a lot with people who are dentally phobic, who haven't been to dentists for a long time, and often they feel embarrassed. They don't smile in photographs. There's a lot of people worried about their social media presence and what their teeth look like in that. And so what they would like, their goals, the benefits for them would be able to smile, not feel embarrassed, not have to worry. And of course, those are the things that you offer. Yeah? Because I doesn't often happen, but you do not get patients coming in going, excuse me, I'm really worried about this occlusal caries on my lower left 6. If they did, you'd be slightly worried. They don't come in. They come in with, I have pain, or I don't like the colour of my teeth, or I don't like smiling. They come in with social problems. So actually what you're doing is using your dentistry to solve those problems. Yeah? You're enabling their lives. You're helping those 743 million people with gum disease to have a better smile. That's amazing. Thank you. Thank you for that. Anyway, I went off a bit, didn't I? So the other thing is to tell people that they're susceptible to the disease and the importance of them changing their behaviour. And the way that we've usually done that is to give them some kind of sense of where they would be on a risk rating. My usual one, because I don't know if you've noticed, I like to walk. My usual one is I say, well, if we think about everybody in the world, there'll be people here, like me, who occasionally forget to clean their teeth, possibly not so good at cleaning their teeth, but actually somehow I've got to 56 and I've not got gum disease. And I'm really lucky. And up here will be some young woman in her 20s, brushes her teeth religiously and carefully, and has gum disease. And she's just really unlucky. So she has to be really good. Now I'm saying this to the patient, you are unfortunately up here. You're unlucky. You're doing well, but you've got to do perfect. Other ways of doing this is we've worked with Provisor, who give you kind of like a proportional risk, or there's color coding, red, amber, green. Don't like red, amber, green personally because it's only 3. I like it more continuum. But some idea that actually you as an individual are at greater risk, and therefore it is important that you change. Yeah. And the third thing is self-efficacy. Self-efficacy, which I'm going to talk about in more detail later. So, while I'm in the motivation arena, you will have seen, I think you may have it in your pack, but it's certainly on the Colgate stand, the 30 seconds prevention coaching resource that Colgate are providing, which is based on the same model of psychological change. And it's, thank you, it has, it uses these kinds of principles with slightly different names. So one of the things it does is it has a salience thing, so it tells you what is novel and new for you. It has a quick win, so it talks about the benefits, that positive framing. Yeah. And the really nice one is what we call social proof. So it does that norming thing. It says, for someone like you, you are in this group, and tells you what other people do. So so one of the things, for example, people go, 22% of people don't clean their teeth at night. Actually, that means that 78% of people do. 78% of people like you think this is something important to do. And when I hear about somebody who's like me doing this, I think that's important. Actually, I was talking to someone just now about creating videos. And actually, if you can create a video for your patients, made by your patients, that's an incredibly powerful communication. Someone like me telling me what I should do is really incredible. And that kind of social proof, that social norming of behavior, very, very powerful. There's a really lovely example, which may be relevant to some of you, is that the government got some psychologists to look at how they could get people to pay their tax on time. And so they changed the letters which say 97% of people like you who owe this amount paid on time. And actually they got, I think it's a very small percentage increase, but millions of pounds in extra tax. So yeah, talk about that. If you want to think about what the benefits for the behaviour change, this is the kind of thing that I would say. You mentioned at the beginning that you feel embarrassed by the way your teeth look. Part of our regular treatment, we'd aim to help you get that confidence back and feel better about the way your teeth look. Yeah. That's the kind of thing we would say. So it's looking at the patient's values and framework to emphasise why those goals are important. Okay, providing information. There's computerised systems to do that. Red, amber, green. Visual points of comparison. Sometimes you see those pictures where there's lots and lots of people, and then there's some that are slightly differently coloured to show that you're one of those very small people. I've just got mine through the post for my heart disease attack risk. Once you're over 50, God, it's terrible being over 50. Like the GP is just kind of just doom and gloom. But anyway, you'll be pleased to know that it's only 5.6% of my chance of me dying of a heart disease in the next 10 years. We should get through this okay, together. Good. Right, self-efficacy is a really important idea. Self-efficacy is difficult to explain, but it's your belief in your ability to control and change your life. And in this particular instance, of course, it's your perception of your ability to change your behavior. 2 examples. 1, my father-in-law, who is absolutely convinced he can never change. He's like, oh, I'm too old to change now. And what I point out to him is that he's changed lots, because 10 years ago, he wouldn't have had a phone, a mobile phone. Is anyone else getting feedback? Yeah, that'll be me. That's my fault. 10 years ago, he wouldn't have heard a phone, but now he uses a phone. So he has made changes. So it's trying to get him to think about how he's made a change. The other thing I think which is important to think about is that you are probably very used to controlling your own lives. Yeah, it goes with having had lots of education, lots of opportunity. You're used to that control. That's not true of many of our patients. And actually, it's probably least true of our most vulnerable patients. People who, when they went to school, they didn't do very well. They failed quite a lot of things. They were always told they weren't quite, the skills they had weren't necessarily as valued as some of the educational goals. So actually, they may not have that same sense of belief. Plus, of course, dentistry is kind of set up to make you think, in part, that you're not in charge. So every 6 months, you go to the dentist, and the dentist looks in your mouth, takes an X-ray, and then tells you whether you have disease or not. I do not go to my GP every 6 months and go, check me out. And if you're a man over 50, don't do that at all. So I actually think that I know what's happening in my body, and I'll go to my GP when I think there's something wrong. But actually, dentistry is sort of more of a dark art. They show you those pictures of black and white teeth, and they go, because you love to involve your patients, don't you? You go, can you see the carious changes here? And if you're like me, you bluff it. Yeah, definitely. Yeah, just there? No, there. Oh, yeah, there. Yes. Anyway, so perhaps dentistry needs to think about that. But, so how can we make people feel that they can change their own behavior? Well, the first thing I would say is that this pointer doesn't work. First thing I'd say is we could try and persuade people socially. This is a very weak technique. Very, very weak. Because if I tell you, oh, you can do it, you have a whole load of experience and belief that you can't. And I would say that, wouldn't I? There are some things that I do in this domain. So one of the things I say is, so you come here, like if you came here 4 times a year, you came to see the dentist 4 times a year, that means that 4 days a year, we're in charge of your teeth. So who's responsible for them for the other 361.25 days? You. So you're 90 and a bit, tiny little bit, can't do 0.25 divided by 4, 90 times more important. What you do is 90 times more important. You're the person that's got this responsibility. Unless you want me to come to your house every day and clean your teeth. Most people reject that. Thank goodness. So we could do that. What's more powerful is this. Enactive attainment. People learn that they can do things by being successful. So what we need to do is to create the possibility of success. Who's got children? Yes. Good. Do you remember when they crawled? Do you remember the crawling? Yeah, so they crawl, and then after a while they kind of stand up like that, and they hold on to things, and then they walk, and then they run around, and then they're 16 and they hate you and they just slam the door in the bedroom. Yes? Would it be reasonable when they're on the floor crawling to go, walk? Walk, baby. Rubbish, baby. Useless, baby. Yeah, they have to go through that process. Perhaps our patients need to learn to go through that process with complex behaviours. Yeah? I can tell you this very quickly. The story I often tell, with his permission, about this is a patient who was called Mr. A. Mr. A was referred to me by a periodontist. A lovely letter. It said, "Dear Tim, please see this patient. He hasn't brushed his teeth for 2 years and I've tried everything. Best wishes." So we've got Mr. A in. Mr. A is depressed. He has very severe depression. And his non-toothbrushing is part of a bigger picture of he doesn't wash, doesn't shampoo, doesn't change his clothes, doesn't go out much. So with the teeth, we said, okay, here's the toothbrush, toothpaste, show me you brushing that surface of that tooth now. I said, that's amazing, that's brilliant. I just want you to do that every day for a week and then come back and see me. And then a week later, he came back and guess what? He hadn't done it. Not at all. Not a sausage. I said, okay, that's my fault. I sent you something that was too big. It's my fault. I shouldn't have asked that. What would help? He said, well, I just forget. I said, okay, I'll phone you. So the next day I phoned him. Can you brush that tooth? Yes. Shh, 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 shh. Great. Next day I phoned him. Brush the tooth. Great. Next day I phoned him. I've done it. Yes. Next day I phoned him. I've done it. He said, you don't need to phone me on Saturday. I went, oh, thank goodness. So that was the start of that. The next week we did 2 surfaces. The next week we did 3 surfaces. 6 months later, his periodontist writes me a letter saying, that's amazing. How did you do it? I said, well, I did this. He said, well, that's ridiculous. You can't do that for everyone. I said, of course I can't, but he's here. Actually, he's over there somewhere. He's here. And lots of people are here. Yeah? And people are all along that continuum. And we should intervene in proportion to what they need. Yeah. Rather than, there are no undergraduates, are they? Good. All our undergraduates, this is oral hygiene. Sorry. All our undergraduates, you need to maintain proper oral hygiene using the modified Bass technique and tall circular. Everything about the way they do that is saying this is unimportant. It's not tailored to the person. It's not based on what the person's already doing. The tone of voice is really boring. Yeah? So we can do that process by getting people to have a success and build on that success. We can also tell people about that or get them to see that. So for our anxiety service, we have patients who've been through the process and they make videos, or some of them will agree to meet people who are anxious. And then they will say, yeah, it's tough, it's hard, I didn't think I could do it. Again, it goes back to that fact that the voice of the person who's been through that is so much more powerful than some grumpy old 56-year-old man. And the final thing is that whenever you make a change, it feels difficult, doesn't it? Yeah, you have that little kind of like, oh, I'm not sure I can do this. So there's a kind of a process of saying you will feel that and it will be difficult, but it will get better. So restating that physiological thing. Okay, do you like this picture? Right, this is the same information written down. Who prefers the picture? Who prefers the written? So, I prefer this. I prefer this because it's got more information and my head works in words. I cannot read a map. You're very lucky I got here today. I just cannot read a map. But that shows you people differ in the way they like information. So again, we have that option for creativity, which is fun. Okay, so how do we do that? Encourage small changes. Do not think of behavior change as a one-off intervention. It's an ongoing process. And that's the joy of it. There's two things I love about working with patients. One is people. People are great. Love people. They're always interesting, always new, always something different. Even the ones that hate me, there's something you can learn. And the other thing is the endless ability to be creative. Think about a new way to solve a problem. I love that, and that's what gives my work joy. Okay, modeling and feedback, so showing people what to do, giving them feedback. Empowering statements, you can do it, you're the one that's important, and restate physiological states. Okay, I spent a lot of time on self-efficacy because it's really important about creating that sense that people can change. So where are we? Quick recap. We have taught the person the skill for using that kind of demonstration and modelling. We've motivated them by emphasising that they can make small changes that accumulate, emphasising the benefits and saying how important it is that they change. The next step was to create opportunities. Yep, good. We do that through planning because that's what you would do, planning. So we simply want you to plan when, where and how you will do the behaviour. So when, where and how are you going to do whatever it is we want you to do? And generally people give you a very simple plan. So you say, if you're going to use interdental brushes, when would you do it? And they'll go, I'll do it last thing at night. Say, well, how easy is that going to be? Are you always really wide awake and have you got plenty of time? There's a lady there who's I have empathy because this is me going to bed. It's like 30 seconds between cleaning my teeth and being asleep. So actually that's unrealistic. When might be another time that you could do it? And what would you need to have through that? And how are you going to do it? One of my favourite little things which a patient taught me for interdental brushes is she said, well, it's really complicated. So what I decided I'd do is to take the big one, see if it fits, and it fits in some but not all of them. Then I tried the next one. Yeah, that's really clever. As opposed to what most patients do is like the pink one, that's my one, fits in every hole. It doesn't do anything in every hole, but it certainly fits. So thinking about that kind of plan, or so planning when, where and how. So planning implementation's been done for lots and lots of behaviours. There's lots and lots of systematic reviews, but there's only a limited studies in dentistry, mostly coming out of our group. So this is the original one that we did, which was about, it's a popular one. Everyone's taking a photograph of this one. So it's like the treatment as usual consultation plus, or treatment as usual plus just giving information about risk. This is your individualized risk communication. And we looked at it in 102 patients with periodontitis. And what we found is if you do that, they think it's they're more likely to adhere, so they follow the behavior change recommendations. They believe that it's important that they do it, and they believe that they can, and they think that periodontal treatment is effective. So that kind of risk information is driving the thoughts, it's driving the intention. So that was the first thing we did, that shows that giving information on risk increases intentions. But because I'm very, very behavioral, what we wanted to do was a study that looked at those components. So teaching the skill, creating the intention, and then doing the planning. Let me give you a summary of this. I did that to build attention. Did it work? Yeah, great. So the summary is that you have the components: teach the skill, motivate, plan. So motivation and planning increase both toothbrushing and flossing. If you take the planning away, it has no impact on toothbrushing, but it decreases flossing. So planning is important for flossing, but not for toothbrushing. And that's probably because toothbrushing is very habitual. A large proportion of the adult population toothbrush. It's just that they may not do it very well. But not many floss. So the planning is really good for a behaviour that isn't established. Whereas the motivation elements is good at increasing and targeting. So what I'm going to suggest is actually think about those elements. There's the capability, the motivation, and the opportunity. So for behaviours that aren't very well established, you probably want to focus on opportunity, on planning. For behaviours that are established but not being done very well, it's a capability issue. You need to improve the skill. And a really good way for toothbrushing to improve the skill is to provide feedback. And you can provide feedback by getting them to disclose. Then they've got direct feedback. Okay, good. Right, so once we've done that, we want it to switch to a habit. There's 3 things you need to do. 1, encourage them to persist and accept failure. I have a little phrase, which I'll pass on to you because I'm so generous, which is I go, my phrase is really expect failure. So when people go and say, how'd you get on with that stuff I asked you to do? I actually asked you to do quite a lot, so I guess you didn't manage all of it. There's 2 possibilities. One is they go, no, I did everything. And you go, wow, that's amazing. Or they go, no, I didn't quite manage everything. But actually what they won't do is say, yeah, I did everything. Like my son does. Yeah, I've done all my homework. Expect failure because that's natural. And you're also saying to people, life happens. Your behaviour does this. But as long as it's doing this, ultimately, that's what we want. So being accepting of the fact that people have, do you know what? People have other priorities than health, like fun and cake. See how I came back to that? Just in case any of you are shopping later. Anyway, encourage persistence. There's a lovely little review by Kwasnicki et al., which says, across behaviours, on average it takes 66 repetitions for something to become habitual. So when you wake up on New Year's Day going, I will never drink again, for instance, it isn't until March the 7th that that's a habit. March the 7th. It's a long time. Yeah. Self-monitoring. So self-monitoring, seeing how well you're doing, is a very good way of getting something habitual. So keeping a little diary, getting people to tick things, because what happens inevitably is the self-monitoring dies off, but the habit takes over. So we do that with getting people to keep a diary, or we design paperwork with them, or there are apps. So Mr. A, who I told you about previously, he used to record his toothbrushing on an app, and the great thing was the app used to remind him as well. And it also gave us data on how well he was doing. And then he lost his phone. And actually, I should say thank you to Colgate, because we used one of your electric toothbrushes for him. Thank you very much. Or customised paperwork they designed with the patient. Okay. How do you put that into action? Well, 1, think more simply than giving knowledge. Anytime you're thinking about giving someone, the usual modified BAS technique, small circles, stop and try planning. Just give it a try. Secondly, enhance their beliefs in their ability to change. I think that's really important. By identifying previous things they successfully changed and encouraging small changes that accumulate. Planning. Why not, instead of telling someone modified BAS technique, small circle, why not just stick it on a video? Direct them to a video. Yep. Okay, I'm going to ignore me whizzing through some slides because there's something I want you to think about. Okay. I'm going to challenge you all. You're going to have a wonderful... you've had 2 days already. It's the third day of a wonderful conference. What I want you to think about is not just me, but obviously I'm the most important, but not just me. There'll be things that you've seen or done that you think, actually, I could make a small change that will make a difference. And I want you to commit to that. Set yourself a goal, a smart goal. Think about what you would need to make that change. What would it look like if you were successful? And when you're going to review it? And then set yourself like 3 months, January the 18th, write in your new diary, review goal. And one of two things will happen. You'll get there and you'll go, oh, didn't quite do that. In which case, set yourself a new goal. Or you'll get there and go, yes, that worked and that was good. And then what you should do then, set yourself a new goal. Because, and I return to the point I made earlier, what brings me joy in my work is this idea of continually improving, continually striving to do something new and different, finding new solutions to old problems that you can try and test and get feedback. And when I hear, sadly that dentists are feeling stressed and tired, I actually think, well, occasionally I feel like that, and then I get back to the things that really give me joy, which is exactly that process, helping people and finding new and creative ways to help people. Thank you very much.